Okay, you should be looking at my screen now. So the more I listen to Nancy's talk, the more I feel that Joanne is really um, insightful in terms of arranging the two of us together. I am a migrant myself, originally from China via US. I spent about 2 decades actually in the US. And now I'm on the traditional territory of the Lekwungen peoples. And I can't you know, express my gratitude and respect for the privilege to work and live on this beautiful land, share it with the Songhees, Esquimalt, and Osanish people. And the Canadian, the nation. So my talk, as Joanne mentioned, I am a professor in the business school. So you might be wondering, what's a business school business researcher doing in a panel on health? So I hope by the end of this talk, you will think slightly differently. So my talk is about home support continuity, and I will actually use two stories to explain to you why I'm here. So my previous life, this is my second career as a university prof. I was a computer systems administrator. So for me, service is really important. I provide professional services to my users. And also for me, it's always about the system. It's how the pieces fit together and how the pieces work together. So that explains why later when I went to doctoral program, I decided to pursue operations management. Now that's another phrase when you tell people that you study and teach operations management, and people would say, huh, that's interesting. But then, it's kind of the facial expression is kind of blank. So essentially, operations management is about how we do things in a business. So operations, if you think about home support, which is the context that I'm very interested in now, the operation is a worker going to a client's home and perform actions and deliver the service. So that would be an operation. But behind that, for that operation to be successful, you need a process. You need the initial intake. You need the scheduler to figure out who to assign to this client, whether they will have a good relationship, a good interaction, and then you will have a binder to make sure that people involved know what to do, right? The tasks, and also have a system of measurements to make sure that it is performing to the initial goal. So operations and process, that's what operations management is looking at. How do we design the interactions and actions? How do we resource them? How do we measure, execute, of course, and then measure the performance? So that's what we look at. And within that context, my lens of looking at how things work, how we do, and how we make things and perform services is through a lens of co-productive service system. So I already talked about the system part, but what do I mean by co-productive? I will use my first story to explain to you. Actually has a migrant link to it. So I was born and raised in China, and I went to the United States for graduate study. The other thing you need to know about me is I love breakfast. So one of the treats that I treat myself is I go to those breakfast places and have breakfast in there. So, and I love eggs. I love fried eggs. So every time they ask me, how do you like your eggs to be cooked? I always say, sunny side up. And then I get my sunny side up eggs. So what you don't know until this point is I do not like runny eggs, runny yolk. I like them to be well done. So it took me 10 years. I still remember vividly. One day, the waitress was very nice, and she just reminded me of my aunt. And she was asking me, how would you like your eggs to be cooked? And by then, I lived in the United States for about 10 years by then, and I felt I have the confidence to ask the question. I said, how many other ways can you cook the eggs other than sunny side up? And she said, well, you can do it soft, hard, over hard. I said, I want overhard. So it took me 10 years to figure out how to order the eggs that I love. So what is co-production? Co-production means you need your customers to be able to tell you what they need and want. You need to design the system that enable them to do that. In the case of me ordering the fried eggs, it was that very nice waitress who is willing to communicate with me and not making me feel like I'm ignorant. It's hard to admit ignorance. So that's what co-production is about. Co-production is about having the system, having the people, and having them work together so that your um, customers, as well as your front lines, they're able to contribute value. They're able to achieve what they set out to do. And that takes a lot of design and takes a lot of discipline, because if we think about it, we all want our eggs fried differently. So how do we deal with that variability? It's not just the material, it's not just what the client wants. It's also your employees. Did they have a good day? Can they smile and interact with your customers as a normal day goes on? So these are very, very difficult questions and very difficult in terms of operations management challenges. And that's what I focus on. So take a co-productive lens to think about all the pieces, all the people, all the equipment, all the technologies that are involved in delivering the service as you intend and as the customer wants, and you will create an experience that they desire. So that's where my work has been on. So the research lens is it takes multiple parties to work together to co-produce the service experience. And that's a system that we need to design and we need to manage. The context that I have studied, I use empirical research methods. Basically, I started with a lot of secondary data and then moved on to challenge myself. And because the projects require to do more primary data collection, such as interviews, and I have to say it's always an interesting learning experience. So I started in hospitality, and then recently I have more projects in the area of health. And in a short while, you're going to see why there is a link there as well. So a couple of projects just to lay the land. Within hospitality, I have looked at a big part of it in terms of co-production is the franchise system. How does the franchisee, actually multiple of them, work with the franchisor in terms of investing in the system, as well as working with their clients, their guests, to make sure that they achieve their goal. Some of my projects looked at the environmental sustainability. So when you stay in a hotel, you probably have seen their environmental initiatives. So those would be some of the areas that I have looked at. How does a franchise system achieve both the environmental performance as well as the financial performance? And I also looked at professional service. This is more of my technology background comes in. So within the hotel, a big part of it is the real estate, the buildings. How do they make sure that the buildings are going to be energy and material efficient? So I looked at the LEED certification and looked at how LEED has evolved over a 25-year period, over 4 generations. And what we found there was the professional service work itself started by being very innovative, but over time, there is a standardization going on and ultimately become automated. So using technology, using even going into the realm of artificial intelligence to allow the work to be completed more efficient and more effective. Now here, the co-production is between not only people, human workers, but also in the future, we're looking at artificial or machine robotic type of workers to work together. So in that context, as you can see, the franchise system actually carries really well into the home care that I'm looking at. A lot of the home care organizations are franchise organizations. So how do they deal with the franchisee-franchisor relationship to make sure that they invest sufficiently into their workers, into their systems to allow the service to be delivered in an optimal way. And also the home support workers, they are not professional, and that actually, they're not considered professional, I should rephrase myself. There are implications related to how they might be perceived and supported in their work. So over time, I started looking at the health context and how do we think about the issues that I am most interested in, such as co-production, such as technology and process improvement over time. So there are a couple of projects, just quickly go over them. One of them is about looking at the system itself. How do we inject more hospitality into our healthcare system? We have heard so many stories that the healthcare is designed for more for the physicians, the high-level professionals, than the frontline staff or the patients. We have heard that the surgery rooms, their schedule is determined by the surgeon's schedule, not the patient's the needs sometimes. So these are very important topics and challenges that we have to look at to think about how do we think about being more hospitable. Hospitable is the root actually connecting hospitality and hospital is actually providing home and providing shelter. So the idea is how do we create an experience, a patient experience that is healing and that is more pleasant as our current system is. So we had a framework by looking across the industry and learning from the hospitality area and see what they do well. How do they put guests first, and how do they design their work and design their services and the systems around it. My most recent project is on home support service, this concept of continuity. Because when I talk to people in home support, one word I often heard is continuity. And the other part of the sentence is lack of continuity. And that's really unfortunate because continuity is such an important aspect of care. And there's a lot can be done. From a business school perspective, we like to say whenever there's a challenge, there's opportunity. So the way to put it is there's a lot of opportunity to manage home support service better, to design it better, so that we will be able to meet the challenges ahead. So let me switch gear a little bit and talk about my approach to home support service. So that's story number 2. I have a friend, Mrs. K, and she is 83 years old, and she now lives in assisted living home, and before that she was in an independent living home. She needed help every morning to put on her compression stocks to help her because she has some heart condition. And the compression stocks are really helpful in terms of getting her ready for the day. But her arthritis is preventing her from doing it herself. So every morning, a home support worker will come to see her and help her put those socks on. What Mrs. K told me was those health care workers, health support workers, are really skillful. They do their job really well. She also told me that they are, where Nancy just said, is a lot of them are visible minority. They were from Southeast Asia countries, majority of them, and they are women, and they tend to be quite shy, and there's a bit of language barrier as well. So what Mrs. K made a point in doing is every time someone comes in, and she gets different workers every time, when someone comes in, she would say hello, and she would make them feel at home, and she would ask them how their day has been going. So that made the home support worker really comfortable, and they actually, in addition to putting on the socks, they sometimes have some exchange of stories, and it was just very good interaction. So what did that story tell me? Is first, home support service really important. It's what gets Mrs. K going. in the day, so to get her ready. And it is co-produced between Mrs. K, her workers, and also the team behind them. There's a scheduling team, there's a management team, there are nurses, and the experience needs to be hospitable, needs to be professional, humanistic, in addition to being effective. And we have a big challenge in doing that, because in terms of the quality itself, we need to make sure it is coherent and logical and timely for every person, every client, so that there's high quality of life as well as higher job efficacy for the front line, so that they feel that they're doing a good job, they're proud of it. One thing that also I heard a lot from my field research is the burnout in this industry. You probably have also heard about it in the news regarding healthcare worker shortage, and burnout is a big part of it, I believe. And not just the quality needs to be higher, the overall volume is growing significantly. Right now, there are about 7.5% seniors in the Canadian population. By 17%, excuse me, by 2041, it's going to be 25%. So we're going to see 50% increase in the demand. And that comes to about 11 million Canadians over the age of 65. Now, a lot of senior or older adults are in very good health. However, when they're reaching in the age of, say, 90s, the care level definitely is very, very high, and we need to be very efficient in terms of allocating our resources without sacrificing the effectiveness, meaning the experience of our clients. So how do we achieve that? My research, a new stream of my research is looking at this and try to think about how do we design and also execute a system to support health equity through transitions. Because an older person from the age of 65 to 95 or 100, there are many transitions in terms of functional capacity. There are maybe multiple transitions in terms of the location where their home is. And that requires a system of service providers, their family, friends, and community, the policy, as well as the older person, to ensure that what we set out to do, which is high quality of life, a good experience of our clients, is going to be maintained, to be achieved. So to accomplish that, my current project is looking at the home support service continuity by focusing on the home support organization and the older person. The external network of family, friends, and community and policy is not within the scope of the study, but I am looking at how the frontline and the team work together to support the home support service. So this project, the objective is really to advance theory. There's a lot of research on continuity. Our literature review has shown that, unfortunately, most of them are in the area of clinical care. The home context has been quite sparse in terms of research. So we're looking at fleshing out the construct within this context, the home support context, as well as develop scales that are suitable for this context so that we can measure and understand the situation and track it so that we can improve it over time, which means that we will be able to hopefully inform practice to help with the client relationship management, as well as identify managerial levers that the organization can focus on to improve their service delivery. And ultimately, it's to ensure the frontline to be able to do their job well and feel confident and feel satisfied from doing their job, fulfilled. So this framework, ultimately, what we're doing now is looking at the service outcomes related to the employees, the front lines, the home support workers, their job efficacy, as well as the perceived service quality from their standpoint. The literature has pointed out that the continuity is a big part of it, as well as our field research and interviews. But continuity is a big concept. It has many dimensions. In the clinical context, the most widely cited literature review by Haggerty and others in 2003 identified 3 dimensions: the relational or interpersonal continuity, the management continuity, as well as the information continuity. In our study, we will be focusing on the relational and managerial. And the informational continuity, we believe it is embedded in these when they interact with clients and as well as with their teams. So we're trying to understand the mechanism. How do we increase or influence the continuity in terms of interpersonal as well as managerial to ultimately enhance the employee's ability to do their job well, to deliver a high level of service. And the literature also pointed some antecedents for us. For the interpersonal continuity, trust is a very important antecedent, a driver of interpersonal continuity, and also conflict. In the elder care settings, it is very important to understand the needs as well as preferences of the older adult. So to be able to address to their needs without creating situations where there are refusals or where there are conflicts. So how do we influence those to increase our interpersonal continuity is a very important pathway. And the other way path is through the management. Many times I heard from clients as well as workers that they feel that the management doesn't understand it. They don't understand the nuances of providing care at someone's home, doing very intimate tasks. So how do the management design their rules and policies and training to support workers? And how do they create informal mechanisms where the workers and their teams can create the team spirit and the cohesion in order to deliver the service that they need? So these are the overall framework that we're looking at, is to focus on the mechanisms to understand how do we measure and how do we understand the drivers of relational continuity and management continuity, and ultimately increase the interaction to make sure that to increase the experience, to enhance the experience of the interaction so that the client feels that the service is coherent, is consistent, and is high quality to their needs over time. So that's the ultimate goal. We have worked on this for quite some time, lots of literature reviews and lots of field work and talking with home support workers. And as you can imagine, the last 18 months or 19 months now have been very difficult. They had to work with many changes and restrictions. So it was very difficult to even ask them for spending additional 40 minutes of their very busy day to talk with us, to share with us their insights. But we were able to talk with some and developed survey instruments to be deployed, and which means we're ready to, we're actually asking for help. I thought this could be a good place for me to ask, because people here are very interested in aging and you have had a lot of experience in this area as well. So if you have an idea about how to recruit home support workers, knowing that they're super busy and they're dealing with lots of changes in the COVID environment, or if you know someone who is a home support worker who's willing to spend some time, our survey won't take 40 minutes. The interview was more involved because we need to understand the nuances, the challenges, as well as what work there. So but the survey will take about 15 minutes. So if you know anyone who's interested in participate, I would love to hear from them, and that's my email address on the screen. So I would like to close by saying the panel's name is Health for All. I think maybe Health by All is also something to be considered, because I think the co-production, that lens, is really focused on how do we enable people to get the experience that they would like to have. One of the things I learned from home support workers is some of the best experiences came when their clients feel they are contributing to the care and they are making progress. So, sometimes it can be just as simple as a button of a shirt, That would be a very important thing. So I think it's upon us to design the system and the process to enable everyone, regardless of the functional capacity, to work together to achieve the quality of life that we're all hoping for and deserve. So that's all for me, and I would like to put my information up there again. So if you're interested in helping us with this project, I'd like to thank you very much in advance.